Good afternoon, everyone. How are you all? It's Laura here from Clear Counselling, and I thought today I would talk about a technique that I use with my clients in my counselling room. I have had a lot of clients over the last few weeks struggling with their negative thoughts or their intrusive thoughts. And this is a technique that we use in cognitive behavioural therapy to try and help people to change or move away from their negative thought patterns. And we call it catch it, check it, change it. So if you can remember those 3 C's, then you may be able to put this into practice yourself. So the check it is first of all checking in and becoming more aware of when you are having those negative thoughts. And we actually spend some time talking about the common negative thoughts that people have. We call them negative thoughts or unhelpful thinking styles. Things like catastrophizing, saying shoulds and musts, so building the expectations very high, comparison to other people, mind reading and assuming we know what other people are thinking about us, although we can't really know. So my clients and I go through these different negative thinking patterns that people have, and I encourage my clients to start to become more aware of when they are having a negative thinking pattern and which pattern it falls into. And quite often we start to see that there's a regular pattern and you move to the same few negative thought processes most of the time. Once we have caught that thought, we then check that thought, and we check that thought for the reality. What are the facts that we have to say that this negative thought is true? What are the facts that we have to say this negative thought isn't true? What is the evidence that we have for what's going on right now or what has happened in the past for us? And do we have any evidence that we can check against that negative thought? Are there any alternative solutions, any alternatives to what you're thinking? And then we change the thought. And we change that thought to a more neutral or perhaps a more positive thought. We're not moving completely away from negative to completely positive, but we're just trying to change that thought so that it doesn't make us feel so emotionally reactive to that thought. So you could have a thought, for example, like, I am a failure. Now, instantly, that's completely negative. You're regarding yourself as a failure and a failure full stop, and not looking at what the situation is really that is making you feel that you might be a failure in this situation. And so we might reframe that thought and change it from, where is the evidence to say that you're a failure? Where is the evidence to say that, you're not always a failure? Where is the evidence to say that sometimes you have successes in things? And we might then change that thought, reframe it into something that is kinder to ourselves. So we might say something along the lines of, sometimes I find things difficult. However, I usually find a way to manage or sort things out. So we're not saying I'm a failure. We're saying sometimes things are difficult, but I do have the ability to be able to find a way. And that just lessens the impact that that thought has on you and doesn't have such an emotional kick to it. So try and remember this CBT technique. Catch it, so catch the negative thought, check it, check in whether it really is appropriate in this situation, what facts and evidence you have, and then change it so it becomes a more realistic thought for you and something that doesn't have so much of an emotional trigger for you. That's it for today. Maybe you can practice that this week, and I'll be back again next week with more tips and hints on managing and reducing your anxiety. Bye for now.